Hi, everybody. Welcome to this new podcast series, continuing our podcast series for with Manoshanti. Today we have with us Dr. Bindu Anigeri. She's a very seasoned uh, psychiatrist and psychologist working with Manoshanti. And today we have a very interesting topic. We're going to talk about psychology in sports. We're going to talk about behavioral psychology and psychiatry in sports. And Dr. Bindu, first of all, welcome. Thanks for joining us on the podcast today. How are you doing?
Thank you so much. Thank you so much. I'm doing well. How are you?
I'm good as well. So, without further ado, let's get started. So, Dr. Bindu, why don't you just introduce yourself for the audience? Just take us through what you've been doing, your journey, and how did you come with, uh, how did you actually choose this as your profession? And love to hear more.
I'm Dr. Bindu. I'm a psychiatrist, and I've been working in this area in the last 18 years or so. I completed my MBBS, and then in the course of completing MBBS, I realized that I am interested in mental health issues, and then that's what prompted me to take up psychiatry as my postgraduate subject. And then I completed it, and I've been working since then. Currently, I am the center head and psychiatrist at Manoshanti, Mysuru, and we run this center along with a psychologist where we see children, adults, as well as elderly. And I'm particularly interested in the area of sports psychiatry and sports psychology um, because sports is a very interesting field, and we also see a lot of mental health issues among sports persons, which has not been addressed in all these decades. Research is also sparse in this area, so this is something that I would like to pursue further. So that's how this interest arose.
That's wonderful. I think this is such a niche and something which is very, very underrated in terms of
Yeah,
and
yeah.
misunderstood as well in terms of. And I myself am a huge sports buff. I love playing sports, so I am really excited to hear what you have for us. And I'm sure a lot of our sports people who follow sports or are sportsmen themselves would really want to would be very keen to know what you have, your thoughts on sports psychology as well. So you mentioned mental health in sports is becoming something a little bit of a mainstream. People are getting to know about it. So why do you think this conversation has emerged so late? Because sportsmen have always been there. I mean, sports has been from the last 100 years.
Yeah.
But I think of late people have started understanding it. So why did people you know take understand it so late?
As you said, mental health in itself is being discussed only in the last few years. So obviously, sports psychology and psychiatry is being discussed only now. For centuries, the sporting environment has mostly focused on the physical performance of the sports persons and the competitive success. And they have very conveniently assumed that everybody is resilient. But psychological struggles have always been ignored or minimized, whether it is in sports or in non sports persons. This must have happened probably because sports was associated with mental toughness, emotional control, and there was a lot of stigma around mental health issues. These conversations may have been perpetuated when the elite athletes also uh, started openly talking about their experiences like anxiety, depression, burnout, their injuries, etc. Actually, thanks to them, now sports organizations are also probably beginning to focus on the athlete's well being and holistic development rather than only physical performance. So, globally, there is some research, but in India, there is barely anything that has been done in this area. So you may find a handful of sports psychologists in India who are trying to address some of the issues experienced by the sports persons, but there is still a lot of work that needs to be done. There is still a lot of awareness that needs to be spread in this area.
Yeah, yeah, I think you kind of I echo your thoughts there. So, from your experience, how common are mental health struggles among athletes at both professional and amateur
Hmm.
levels?
So we barely have any research in India on these issues among athletes in India. Now, all the research data that we have is mostly global. About 30% of athletes have mental health concerns. They have depression. Misuse is seen in about 20% of individuals involved in sports. Most common conditions that we see are anxiety, depression, sleep disturbances, burnout. Um, Now, while the rates of depression in athletes versus non athletes might not be too different, but it should still be acknowledged because it can have consequences on the physical performance of the individual, the training of the individual, and it can also probably lead to more injuries in these sports persons, which can further affect their performance. So, I think all of these issues need to be acknowledged and addressed. Now, muscle dysmorphia is again one more condition which can be part of the body dysmorphic disorder, where an individual perceives their body as less muscular, although it is adequately muscular, and they feel that they are too small to perform in the sports. This is a misperception of their own body, and because of which they might relentlessly work more and more, which might lead to overtraining, lead to fatigue and subsequent injuries. They are also known to have eating disorders. Use of steroids is another common problem among athletes. There's also a risk of suicide. Now, eating disorders are generally seen in those sports where weight is a criterion, so generally seen among female athletes. Use of steroids mostly among male athletes. Risk of suicide may be seen in either of them. So, but then there is no conclusive data on the rates of any of these issues in elite athletes. But we do know from current professional athletes that they do suffer from mental health concerns from what they themselves have been expressing in the last few years.
Um, I think yeah, that's a valid point. So there's a perception uh, among the general public that sportsmen are inherently mentally tough, right? But this assumption can sometimes be misleading. And what are some of the pressures that athletes face, and why they need to work towards their mental toughness as well. It's not something that of course, they may be born with, but they need to constantly work on it. Otherwise, it could affect their performance.
Yeah. So, participation in sports, be it formal or non-formal, in a formal or a non-formal setting, is a popular pastime for many individuals in the world. There are a lot of positive benefits associated with sports participation, which includes increased mental toughness, perseverance. There's a positive self-esteem. There's a positive body image, and then their fine and gross motor development is also way better compared with other people. They learn teamwork, and also they have better problem solving ability. So, more than a perception, I can say that athletes are mentally tough compared with other people. Now, but then there is also an element of uh, difficulty in this. Uh, but the benefits are, aside from the countless physical, mental, and cognitive benefits, they are also known to have better attention and concentration and memory compared with people who are not involved in any kind of physical activity or sports. Um, Now, the physical exercise also can release a host of happy chemicals in the brain. These are called endorphins. So, whenever one is practicing, and there's a certain degree of well-being that sets in with, which also helps the physical and mental resilience. Now, while all of this is true, they're still human and prone to develop mental health issues due to various reasons. This could be either due to some personal aspects or due to the sports itself. Now, it may or may not be directly related to the sports, but it should be acknowledged nonetheless. And it should be acknowledged mainly because it can further affect the training and physical performance of the individual. It can lead to injuries. So while we still believe that athletes are mentally tough, we cannot ignore the fact that they too sometimes are vulnerable to develop mental health issues. So we can't completely assume that all of them are mentally tough and do not require any kind of support or attention.
I mean, yeah, I mean that's true. We assume they are somehow superhumans, but they are
Yeah,
humans in the end. You mentioned injuries, physical injuries. Now we see, physical injury is part and parcel of a sportsman's life, whether it's professional or amateur, right? And and I think that somewhere down the line, unless even if you're supremely fit and very disciplined and take care of your mental and physical health over time, but injuries are do happen. One of the things, if suppose you have a long-term injury, right, it could really play a psychological impact, maybe because they're out of action and it affects
yeah,
their mental health. So that is the one part also. So we focus on-field performance, right, mental health, but also when they're away from the action and when they're recuperating from injuries. It does play part in the mental health. How
definitely.
do athletes cope with that?
So injuries have always been a part of any kind of physical activity. Now it depends on the age of the individual, the sex of the individual, the anthropometry, the skill level, and the physical fitness. Although sometimes we say the physically fit cannot get injured, they have their own injuries. Now it also depends on their psychological predisposition. For example, the personality of the individual, the history of mental stresses they have, and their ability of coping resources. All of these also are known to modify their injury risk. Now, external factors like the level of competition and the playing surface have also been implicated in injuries. Um, Recently, I was talking to a physiotherapist who was very keen on collaborating with the psychologist and the psychiatrist. He says that in the process of rehabilitation, he finds that a lot of them develop anxiety and fear of not being able to recover, and which can further affect the rehabilitation process itself because they are not feeling confident enough. They are continuing to be anxious. There may also be sleep disturbances, which further affects the recovery. So there would be so that shows that psychologically also they feel affected and they need support in that area, which will help them recover further. The confidence that they need to recover is something that is very important.
Very true. So I know that you know issues like anxiety, burnout, feelings of isolation or depression is common amongst young professionals, experienced professionals also. And it's if you're a corporate executive or in non-sports related occupations, it's something which happens. But do sportsmen also suffer, often experience this during their careers? It could be that, it's not just a mental health conditioning and strengthening. It's something that could have a long-term implications. And also, if you could also pick any, from your experience, having worked on so many cases, any example that you could tell the audience on something that you have seen in your career, which kind of helped and you help that person cope with that condition.
Yeah, definitely. Just like any other person engaged in any other occupation, it is very normal for a human being to experience or burnout or anxiety or feelings of isolation, feelings of inadequacy, lack of confidence, etc. So athletes are constantly training. uh, they have lesser socialization, lesser time spent in recreation. they have a pressure to perform, etc. Now, hence these experiences like burnout, feeling isolated, feeling very anxious, left out during their careers is very common because they have to maintain a very disciplined life. Their opportunities to socialize and form other relationships might be lesser compared with other people. So this is one of the things that they can experience and have difficulties with. But then um there is no option. They have to spend that much time, energy on these activities if they have to perform better, because the pressure to perform is also very high in these individuals. So currently, I'm also helping a young female athlete with symptoms of depression and anxiety. Now, her symptoms of anxiety and depression are not directly related to the sports or any injury as such. It's mostly because of personal issues. But what I would like to emphasize here is that all these symptoms of depression and anxiety are affecting her training and her ability to perform in the day-to-day sports activities that she is.
Which sport is it? If I
She's an athlete,
Achha.
running long distance running, mostly endurance sport. So that was affecting. She had reduced the amount of time that she was spending on training, practice. Uh, she was out of her sports group, and then she was feeling isolated, etc. But then treatment was started. She was at a point where she required some medications, and then within about 2 or 3 weeks she was able to overcome some of these symptoms, and then over a period of 1 or 2 months she was able to recover from all these symptoms and get back to her daily training. And she was also able to participate in some of the long distance uh, marathons. So this is something which was very heartening to me, seeing her back on the field.
That's so refreshing to hear. I mean, that's uh, I think you mentioned young athletes, right? I think we spoke about athletes in intense competition when they become adults, but sportsmen and sportswomen start training very early in life, right? For most sports, and that's how it is,
Yeah,
especially if you're looking at competitive Olympic sports or team sports. Uh, Generally, it starts around 8, as early as 6 at times. So, uh, and I think that at a very young age, these young athletes, prospective athletes, face intense competition and expectations early in life. How can this affect their mental health and development?
yeah. Um, while we say that, I'm sure most of them are able to navigate through these situations where the expectation is that much, but they're also getting the required amount of training and the support from parents, etc. Permission from school to stay away and focus more on the competition. So that much of support is available currently for supporting these young athletes. But sometimes young minds and bodies may not be prepared to handle the unrelentless training, the disciplined life, because they are children. They are unable to lead the life of a normal child or a teenager, where they miss out on all the fun social interactions which they might have had if they were not involved in these sports. So this could lead to isolation, this could lead to fatigue, burnout, and sometimes they may find it difficult to handle the success at a very early age. And this can lead to anxiety, sleep disturbances, loss of interest in the sport, injuries, because they are very young, and they may not be able to understand their bodies as much as an adult would. So these are some of the issues that young athletes may face. Now, a lot of things will also depend on the parents and the coaches, their communication styles, how they encourage them, how they support them mentally. Uh, are they criticizing them publicly and things like that? So younger athletes probably face more difficulties than an adult athlete, because their maturity, their exposure to uh, the society, life, etc., is much lesser. They're less prepared to face the world at such an early age.
Yeah, glad you brought up parents and coaches because that's something which I wanted to talk about. Parents and coaches play a very, very important role. I think the role of a coach, particularly,
Yeah.
is far more important because a good coach, and there's so many examples across Indian sports, world sports, where we have seen coaches can actually make or break a young athlete's, sportsman's, or sportswoman's career. So, what role do they play, and what is positive conditioning and coaching, and what you would call as negative coaching, which I think you need to avoid so that young athletes, don't get emotionally broken down very early in because of you to quote a to example. I know it's a movie. I'm sure you've seen the movie Dangal,
Yeah,
where
yeah.
that's a very popular movie. Of course, people had pros and cons of it, but something like is that the coaching methodology? Is that something which you would recommend, or is it something uh, that you say can in the long term does more harm?
Uh, Parents and coaches have the most influence in the life of an athlete through their attitude, their communication styles, and their expectations. They can either strengthen the resilience and well being or cause burnout, stress, and other difficulties in the athletes. So, they should be providing unconditional support, emphasize the effort rather than the outcome of the event. And the athletes also should be allowed to express their emotions, whether it is fear or anger or anxiety or anything of that nature. And they should also avoid harsh criticism, especially publicly shaming them can really break any individual, not just in sports, any person for that matter will be affected by such treatment. Parents, especially, should not treat sports as a pathway to social status or financial status. So, whether parents and coaches are uh, protective or harmful depends on their communication styles and the support that they offer to the athletes. So, like I said, they have a major role to play in, because they are the people who are closest to this uh, athlete, and everything that they say and do will have a bearing on the athlete. Now, about Dangal, I too have very mixed feelings. While I really appreciate uh, the relentless effort that the father slash coach takes in training his girls, the fact that he believes in his girls is something that is very, very heartening. At the same time, it is also seen that the girls were on the verge of breaking in the course of the in the course of the in the course of the training and coaching, but they were also extremely resilient in picking themselves up and doing what they had to do. So all in all, it ended well. So
Of course, it was a movie,
yeah, yeah, yeah.
but of course, it was based on a real
Hmm.
case as well. But um, so, what are the early signs that an athlete might be struggling with mental health? And also another follow-up on that is, are coaches particularly and parents as well trained these days to understand and act whether a prospective athlete, a young athlete, is facing mental issues, and how do they address it?
Hmm. So, to answer the first question, sleep disturbances, uh, some amount of inability to train like before, and most of all, injuries could be the first signs of uh, an athlete struggling with mental health issues. Because a declining mental health can make an individual prone to injuries. So one has to watch out for such signs, it's both the responsibility of the athlete as well as the coach to keep a watch on any of these things emerging and address them as early as possible rather than pushing themselves further. Um, the other aspect is uh, yeah, what was the other question you asked me?
Our coaches today, yeah.
Yeah, I don't think there is the required and desired mental health awareness among coaches as well as parents, which would otherwise help them to support the athletes. Policy of the organization should start changing in this area where they become more aware of the requirement of these things. There should be structured multi-level mental health support systems that would address prevention, early detection and treatment rather than intervening at a point where there is a crisis. It should become integrated into the sports system rather than providing help during crisis. So there should be routine mental health screening, monitoring during high risk phases. There should be early detection of distress, especially injuries. There should be access to professionals. And important aspects are maintaining confidentiality. There should be easy referral pathways, mental health literacy programs for parents, athletes also, because athletes also have the responsibility of recognizing these problems in themselves and then seeking help. And coaches also should be made aware of mental health issues that one can face in the process of training for sports.
No, interesting. I think you mentioned about you know, the role of coaches. We've spoken enough about it. Parents also mentioned, but I think it's also the larger ecosystem in general. The sports organizations obviously they play a big role, and I think in India, sports is really, except for maybe cricket or tennis, which are
Hmm.
global sports, badminton to an extent. Most sports struggle with understanding of mental health and performance related issues. So, what kind of support systems should sports organizations provide for athletes? And what are the and also would you recommend working as from Manushanti? Would you recommend working with sports organizations to make their athletes aware of mental health issues?
Definitely, I would definitely want to collaborate with the sports organizations and help with awareness of the mental health conditions and the anxiety that any individual would experience and help them with all of those issues. So that would be a great opportunity.
Got it. Now, we spoke enough about young athletes, but what happens generally is that, you know, it's lot of sacrifices required, right? We spoke about Dangal, the kind of sacrifices those girls did to become Olympic champions or other international gold medalists is amazing. They need to do a lot of sacrifice. It requires a lot of, they miss out on normal life. So and that sport becomes their identity. So they
Yeah.
miss out on normal life and all that. So does that really affect, say, later in life that, once they are the prime of their careers and they're on retirement, does because sport is their identity, do they struggle with because they have nothing else to fall back on and their identity is so much associated with that sport, nothing beyond it? So have you seen cases where, and you recommend sports athletes to have maybe a life outside sports, but it's a bit of a catch-22 situation because you need that focus and discipline, but at the same time, you want your time off as well. So it's a very tricky, situation here. So what do you think?
There is something called athlete identity. It is defined as the exclusivity and strength with which an individual identifies with the athlete role. And he looks up to others for confirmation of that particular role. Now, to some extent, an athlete's self perception of their athlete identity can provide an important measure of their longevity in sports. A better athlete identity, they will last longer in a particular sports. Now, Stronger athlete identities have been associated with positive health outcomes. There will be increased sports engagement, performance is better, there is better self-esteem and confidence, and then they also have improved social relationship. While I say that, conversely, if there is a sports related injury, stronger athlete identity individuals may have depressive symptoms, because it's so important for them to be in that role that anything lesser than that is not acceptable. So it has also been suggested that athletes who hold a stronger athlete identities may neglect other identities and role responsibilities to maintain this athlete role, because that's the amount of discipline, that's the amount of uh, time that they need to dedicate to achieve that role and be in that position and maintain that position. So sometimes this strong athlete identity may be helpful in some cases, sometimes harmful in others, especially within a sports injury context. It can be very similar to what an individual experiences while retiring from his profession, a non sports profession also, because they have spent that much time, energy on fostering all their skills and, you know, uh, uh, contributing to that particular role, that they may have neglected other areas. So, what happens at the time of retiring is that they feel there is a sense of loss of role or identity, and they wouldn't know what to call themselves. So, because they don't know how to define themselves outside of their professional role. So, it could be similar to that, which anybody would experience.
Well, let's talk about the treatment a little bit. We have spoke. So, is the treatment for a sports-related condition too different from a normal uh, case? Of course, the symptoms would be similar, but the profession is different. But do you approach a sports-related mental condition a little differently compared to normal one, or is the treatment a little different? Process a little different?
The medications that are used are the same. The approach that we take to treat these symptoms may be similar, but we would try a more non-medication approach for these individuals, because again, all of this will depend on the severity of the symptoms and the impairment that an individual is experiencing in their sports field. Now, if it is mild, psychological help with the help of a clinical psychologist with psychotherapies might be sufficient to handle any of these symptoms or impairment. But if it is severe enough to cause more impairment, then medications are required. It's the same medications that we use in non-sports persons also, but there's a slight catch here where the WADA might reject these sports persons based on the drug levels and things like that. Especially benzodiazepines are obviously avoided in these individuals. Again, there is little less clarity on what drugs can be used and what cannot be, because there may be some molecular structure which may be similar to certain chemicals which are absolutely contraindicated. So this might cause a bit of a confusion, and they might end up rejecting some of these individuals which are not really affecting the sports performance. So some uh, thought has to be put in this area before the treatment is started.
Uh, we're almost at the end of our session. Couple of last questions. We generally assume, I feel that the two professions which people assume, the people involved in this profession are mentally tough. When they have to be mentally tough. They just cannot show any sign of weakness. Is the armed forces and sportsmen in general, right? Those are the two professions that you can't even show mental weakness or mental vulnerability, if I can call it that. So, what is your piece of advice? I mean, it's mental health is becoming, people are more aware, and with especially the younger generation, you're seeing that normally in corporate life as well and day-to-day life itself, people are more open, but I still feel that with these, especially in sports, people are don't want to come across as weak, right? And that could affect their performance, and what will, because it's supposed to be a tough profession. So what are your advice for somebody who thinks that they need advice and need support, and what would make them comfortable approach somebody like you?
I will answer this question by first saying how proud I am of sports persons for being what they are, their endurance, the discipline they follow, and the fact that they fully enjoy what they do. I am sure they possess tremendous ability to push themselves even in adverse situations. Yes, they are definitely mentally tough and resilient. While they may be successful in most situations, things might sometimes go out of control, and distress might build on. Now, pushing yourselves under such circumstances can sometimes be counterproductive. Now, if you notice that the more you push yourself, the more you're distressed and becoming prone to injuries, then it is time to seek support and help. Remember that seeking mental support is also a sign of mental strength. Not everybody will uh, have the courage to seek help. That's another sign of resilience. So, try to talk to someone about it, a close friend, a family, or a mental health professional. Remember that you are very important and you need to take care of yourself. So, seeking help will help you further in your journey towards becoming a more successful sports person. So, take care of yourself.
Absolutely. We just look at the outcome or the end result of somebody. For example, the couple of days back, a table tennis player beat the world number one table tennis player from China. I mean, nobody knew about that. But and also if you take Usain Bolt, right, his record is around 9 seconds, right? But for that 9 seconds of effort, it took 9 years of hard work behind the scenes, of a lot of pain, blood, sweat, and tears, I'm sure, to get for those 9 seconds. So we need to give them much more credit, and I think that this was fantastic, Dr. Bindu. I think we need to provide a very strong supportive ecosystem to sportsmen, sportswomen, and also the people who are part of their ecosystem, like coaches and parents. I think we should do more. I'm sure that we should probably have. This is not the first of the discussions. We'll probably go deeper into this, but this was great. Just I'll end with a very simple. Just which is your favorite movie, sports movie, where you said that this is really what is true to what as a doctor with 18 years experience, not as a a film buff or anything. Which movie you think got sports psychology, sports coaching, and how a sportsman evolves perfect? It could be anything. It could be an Indian movie. It could be a foreign, anything that comes.
Mm. I think in the recent past, Dangal definitely had some impact on me. The the toughness with which all of them face all the entire family is involved in this. That's what it takes to build build an elite athlete. That's the kind of sacrifice every family member has to make in all of this. And what the public sees is only the success, the medals, the trophies, but what goes on underneath is something only the family uh, can say. The amount of sacrifice, the amount of time management that each one of them is trying to do is something that the public will never be able to appreciate. Also, a message to the public would be to view sports persons also as humans and not. The public should stop feeling entitled to be given victory by the sports persons. Treat them with more respect.
Yeah, so true, the last part. But the funny thing is that public probably only knows sports which are very popular, like
Yeah.
cricket, for example. There are a whole bunch of sports person who public don't even know, and they would love to have that attention. So I think that it ends with I think we need to support our sportsmen in all aspects. And sure, this was something which we'll take from this session. It was great talking to you, Dr. Bindu. I think
Thank you.
I was really interested because I used to play sports very early in my life, so I absolutely echo some of those thoughts. It was great having you, and have a great. Sure, we'd love to have you for another session if possible. Thank you.
Sure. Thank you so much, Ketan, and everyone. This is a topic which is very close to my heart too, and I would like to work in this area in whatever possible way. Thank you so much.
Absolutely. Thank you, Dr. Bindu.
Thank you.